Assalamualaikum warahmatullahi wabarakatuh. Welcome back to my YouTube channel. Okay, previously, let me introduce myself. My name is Dina Agustina. I am a student at TEP Islamic University, Raden Fatah, Palembang. Especially, I from the Faculty of Tarbiyah and Tertiary English Education Study Program. Okay, in this video, I want to speak about high rates of maternal and infant mortality in Indonesia. I made this video for my final semester test in formal speaking subject. Definition of maternal and infant mortality rate. Infant mortality rate is an indicator commonly used to determine the degree of public health, so that many health programs focus on reducing IMR, where IMR refers to the number of babies who died between birth and infancy. Definition of maternal mortality rate. Maternal mortality is the death of the mother due to pregnancy, childbirth, or during the period. Maternal mortality rate is an important indicator to describe the status of maternal health and nutrition, environmental health, and level of health service. And then cause of the high rates of maternal and infant mortality in Indonesia. Medical cause. Every minute a woman lost her life in the world, and this is due to complication of pregnancy and childbirth. For the case of Indonesia, it's almost the same as case in Egypt, Bangladesh, Libya, Algeria, Morocco, and India. Post the health of all female that are death's mother. Every hour in Indonesian women deaths due to pregnancy and childbirth or more than 1 in 5 due to pregnancy and childbirth or more than that among Indonesian women are associated with pregnancy. And the non-medical cause. And in identifying the indirect cause of maternal death, at last two factors are considered to play a major role. First, emphasizing the importance of level of socio-economic life of women, with the proposition that high maternal mortality is the result of poor socio-economic conditions, including malnutrition, whose economic limitations are likely motivated by poverty. On the other hand, low maternal mortality is possible because pregnant women receive adequate nutrition. And then factor affecting the death of mother and baby. Factor affecting infant mortality. There are several factors that can affect the risk infant death. The factors that influence the rate of infant mortality include mother factor. Most of the mothers are babies that has reached age to get pregnant that is more than 30 years. The ideal mother age to experience pregnancy according to the BKKBN is between 20 until 30 years. Most of the mothers choose giving birth to her baby premature. And then 2. Baby factor. The baby who died is known. Most were born premature and have low birth weight less than 2,500 grams, which is many as 7 baby out of 11 baby. Baby is born premature. Usually her organs haven't formed previously, so that prone infection or disorder other health. Environmental factor include in physical factor including weather, season, circumstances, geographical area, sanitation, circumstances, good house form, building structure, ventilation, light, and the physical condition of the host can indirect show the quality of health of family. And then health service factor. Indirect causes are dominated by quality antenatal care, quality spectrum, and neonatal care, and health socialization service quality. Antenatal care is affected by reliability and midwife care and compliance. Pregnant women do an examination. And then factors that influence maternal mortality. There are several factors that can affect the risk of maternal death. Factors that influence maternal mortality include age, socioeconomic status, medical care availability, parity, number of pregnancies. An impact of high mortality rate for mother and baby. Impact of high maternal mortality rate. Maternal mortality must be reduced because of the large loss that must be borne. Using research in China, the women who is familiar call that explain that its mother dies during pregnancy or during childbirth. And then the impact of high infant mortality rate, head of the nation population and family planning agency BKKBN said that there is relationship between life expectancy and infant child mortality in Indonesia. Therefore, BKKBN will continue to work with related parties, including the Ministry of Health, to continue to reduce infant and child mortality. On ways to keep promoting to the two children program enough. And then based on the statistical data of the diagram, it is explained that the mortality rate for infants and toddlers has decreased, show better quality in the holding infant in Indonesia. And then based on the statistical data of the diagram, it is explained that the maternal mortality rate, especially during childbirth, is not always changing, sometimes decreasing, sometimes increasing by an unstable percentage. And then solution to treat increased number of mother and baby death. 1. Family planning, and then antenatal care, and then maternity care, and then post-birth care, and then control of sexual transmitted infection, HIV and AIDS. In addition to the above solution that a mother needs to pay attention to are how to maintain health during pregnancy, be it eating nutrition food, doing medical check-up for pregnancy, routine prenatal visit, taking prenatal vitamin, and choosing a good obstetrician. And then we also need to take yoga, a class of or prenatal exercise. And then we also need to prepare for childbirth, make a good pregnancy and delivery planning. And then smart in choosing a place of delivery. And then pay attention to the health of newborns. And then I think enough for my video and for my explanation. The last I say thank you for watching, and then the last I say wassalamualaikum warahmatullahi wabarakatuh.